Hello everyone, I'm Venkat Ramani, working as an assistant professor from Triple M College of Nursing. So today the topic is about newborn assessment. Before going to the chapter, we'll see what are the objectives of the newborn assessment. The first one is to evaluate adaptation to extrauterine life, to detect congenital anomalies or birth defect, to assess physical growth and development of the child at the time of birth, to identify risk for infection or complications, to determine the gestational age and maturity, and also to ensure proper functioning of the vital systems and to monitor the neurological reflexes and the behavior. Okay. So before going to this, what are the articles required for the newborn assessment? We need a clean tray to organize and to keep all the required items, clean gloves to prevent the cross infection, weighing scale to measure the birth weight, measuring tape to assess the or to measure the anthropometric measurements like head circumference, chest circumference and length of the baby, thermometer to record the axillary temperature, stethoscope to auscultate heart and lung sound, pediatric sphygmomanometer to measure blood pressure, pen torch light or torch light for pupillary reaction and general inspection. Then we also need a cotton swab and sterile gauze for cleaning the eyes or umbilical area if required. Then we need a baby blanket or towel while doing the physical examination or a newborn assessment. We need to keep the baby warm. Diaper or clean linen to keep the baby dry and clean. Okay, and these are all the articles required for the newborn assessment. Then step by step how we can do the procedure. Let us see. So first we need to assess the general appearance, which includes posture, activity, skin color, cry. Then the vital signs, we need to assess or measure the temperature, respiration and the pulse. Pulse in the sense apical pulse we need to record. Anthropometric measurement, head to toe physical assessment, and after examining the head to toe physical examination, we need to do a reflexes examination, gestational assessment with the help of the Ballard scoring system if needed. If we doesn't know the gestational age of the baby, then this is helpful to assess the gestational age of the baby. It has actually two components to assess the physical maturity and as well as the neuromuscular maturity. Okay, and each component has 6 criteria and the total score will be 1 to 50. If the child scores 0 or 1, then we consider the child's gestational age is 26 weeks, and if the child scores 50, then we can consider the child's gestational age is 42 or 44 weeks of gestation. Then after doing all the examination, we need to document in the record newborn assessment chart. Okay, so what is newborn? So newborn means it is a neonatal period between the birth to 27 or 28 days. Again, under this we have 3 classification: term, preterm, postterm. Term is a newborn born between the beginning of 37 weeks to 40 weeks. Preterm is baby born less than completed 37 weeks of gestation. Postterm is baby born after 40 weeks of gestation. So how will you prepare before newborn assessment? Review of mother's medical and pregnancy history, that is antenatal history we need to collect. Ensure cleanliness of hands. We need to follow a proper hand hygiene before examination to prevent cross infection, and practice universal precaution. The examination environment should be conducive, and the attention must be given to the amount of light and noise in the examination area, and also the length of the time that the examiner is going to take as to gain an attention. And a thorough examination of a newborn assessment should not exceed more than 10 minutes, not more than 5 to 10 minutes. And here we have 3 phases in assessment, that is initial assessment, transient assessment and follow-up assessment. Okay, in initial assessment we need to assess the Apgar score. It was discovered by Virginia Apgar. Okay, so it has 5 criteria. Based on this 5 criteria, the score will be given from 0 to 10. Okay, so 0 to 3, 3 to 7, and 7 to 10. 7 to 10 is healthy baby, whereas the 4 to 7 is the baby needs some kind of assistant breathing, and 0 to 3 immediately the child needs a resuscitation. Okay, so here the heart rate, when the baby heart rate is absent, there is no respiration, there is no movement, and reflex also not getting any attention or response, then the baby looks pale or blue. Then in that case we give a score of 0. Then if the heart rate is slow and below 100, respiratory rate is irregular, slow, weak cry, muscle tone will be slow, flexion of extremities, and grimace will be irreflex. Then the body will be pink, and sometimes the extremities will be blue in color, in which case we give a score of 1, which means for all these 5 criteria the baby scored about 5. Okay, needs some kind of assistance. So when the baby is having 100 pulse rate or above it, then good strong cry is there. Then when we look into the muscle tone, the baby is flexing well, cry is there, sneezing reflex is there, and the baby looks completely pink. In that case we give a score of 2 for each criteria, which means the total score will come around 10. So that means the baby is healthy, we can shift the baby to the mother side. Okay, so this is the ABGOR scoring system. Next one is transitional periods. Previously we have seen the initial, and now we are seeing transitional period, which has first period, resting period, and the second period. So during the first period, the color may be acrocyanosis, temperature will be altered. It may fall to hypothermia. The heart rate will be rapid, that is 180 beats per minute, and bowel sound will be heard after 15 minutes. And during the resting period, color will be stabilized and temperature will be stabilized, heart rate will be slow, 120 to 140 beats per minute, and the bowel sound will be present. During the second period of assessment, the transitional period, the color will be quickly improved to pink color with the movement. There will be a change in the movement, and temperature will be increasing, wide swing in the rate of activity, and the bowel sound will be often the baby will pass the meconium. So next, the follow-up assessment. So during which we usually measure the height and weight of the baby, then the other anthropometric measurements like head circumference, chest circumference, and the length of the baby. Okay, so height, when we consider the normal height for the male, it is 52 centimeter, for the female it is 50 centimeter. So when we will consider it as abnormal is 46 centimeter and below it is, we will call the baby is IUGR or small for gestational age. When the baby's height is 57.5 centimeter or above, then we can categorize the baby as post-term baby, either post-term baby or something. If the parents are very taller, then their gene may pass to their offspring. So that is considered to be normal. So when the length is 57.5 and also there will be a bigger head circumference will be more and the weight will be more. So in that case we can suspect for endocrine disorder. Normally there will be hyperinsulinemia will be associated with this condition. Okay, so next, weight of the baby normally ranges from 2.7 to 3.8 kg. For the male it is 7.5 pounds and female it is 7 pounds. The head circumference, the average head circumference will range from 33 to 35 centimeter. For the microcephaly or preterm baby, this head circumference will goes less than 33 centimeter or 30 centimeter. And the chest circumference, the average normal range will be 31 to 33 centimeter. Anything goes beyond this limit or less than this will be considered as abnormal. Then the mid-arm circumference will be 8.5 centimeter. When the baby mid-arm circumference is less than 8.5 centimeter, then there is a risk of infection, or then we can call that baby as an high risk. We can suspect for high risk neonate. Okay, chest circumference will range from 31 to 33 centimeter. Then the vital signs are pulse, respiration, and the blood pressure. Okay, so pulse or the temperature, the normal temperature of the newborn baby is 36.5 degrees Celsius, and the pulse is normal pulse varies from 120 to 160 beats per minute. At birth, the rapid it will be rapid as 180 beats per minute. Always it is good to find the apical pulse. Check the apical pulse at the fifth intercostal space in the left side, just below the nipple. Okay, so when you consider the respiration, the average respiration will be 30 to 60 breaths per minute. At birth, it will be 80 breaths per minute, and gradually it will come to normal. The pattern will be irregular, and short periods of apnea will be present initially. Then it will adapt to the extrauterine life, and it will become normal, regular. It can be measured by watching the abdominal raise movement. Okay, so whereas for adult we usually see the chest movement, whereas for the newborn we usually count the respiration by seeing the abdominal raise. Okay, then finally blood pressure. At birth, the blood pressure will be 80 by 40 mmHg. At 10th day, it will increase by 100 by 50 mmHg. So we need to compare both the upper and lower limb for accuracy when we check the blood pressure. Okay, so that's all about the newborn assessment during the initial period, and we'll see this in detail in the next presentation. Thank you.